Hi, hello, welcome back. So today we will be seeing about evaluation and management interview question part 2. Okay. So if you are preparing for ENM projects or ENM interviews, you can go through this question. It will be really helpful for you. So first question is reporting time, that is counseling and coordination of care. Answer: it may be considered the controlling factor to the qualifying particular ENM level of service. So you can read the definition which I have given here so that it will be really helpful for you. Second question, common modifiers used for ENM. So the common modifiers used in ENM is modifier 24, modifier 25, modifier 32 and modifier 57. Okay, so next the third question which is given is what is the inpatient and emergency room coding? Emergency coding is 24 hours without appointment, can walk in and get treatment and discharge. Inpatient coding is getting admitted with an overnight stay. So this is the difference between inpatient and emergency coding. And what is the difference between critical care and emergency care? Emergency care deals with immediate life-threatening injuries and medical condition. Critical care defines ongoing care of a patient who is dangerously ill or requiring advanced care. Read the definition carefully. I have given nearly 4 points for this. So next question is difference between principal diagnosis and primary diagnosis. The primary diagnosis is an outdated term in outpatient setting. The term was changed to first listed diagnosis some years ago and is the main condition treated or investigated during the relevant episode of outpatient healthcare. Next, define consultation. A consultation is a type of ENM service provided by a physician at the request of another physician or appropriate source to either recommended care for a specific condition or a problem to determining whether to accept responsibility for ongoing management. Next, what is the difference between inpatient and outpatient coding? Inpatient means a patient is formally admitted to the hospital on the physician order, where the patient is admitted for an extended stay, maybe in a hospital, nursing home, rehab or long-term care facility. Who is a qualified healthcare professional? QHP. Nurse practitioner and physician assistant, physician extenders who are licensed to practice medicine. They are called as qualified healthcare professionals. Next question. How is a self-limited or minor problem defined? A problem that runs a definite and a prescribed course, is transient in nature and is not likely to permanently alter health status. The examples I give are cold, insect bite and tinea corporis. How is a stable chronic illness defined? So how is a stable and chronic illness defined? A problem with the expected duration of at least a year or until the death of the patient. So stable means for the purpose of categorizing medical decision making is defined by a specific treatment goal for the individual patient. So you can read the definition and see. Okay, how is an acute uncomplicated injury illness may be defined? A recent or new short-term problem with low risk of morbidity for which treatment is considered. There is a little to no risk of mortality with treatment and full recovery without functions. And how is a chronic illness with exacerbation, progression or side effects of a treatment defined? A chronic illness that is acutely worsening, poorly controlled or progressing with an intent to control progression and requiring additional supportive care or requiring attention to treatment for a side effects, but that does not require consideration of hospital stay. What is the MDM in evaluation and management? MDM is how the provider rates the degree of difficulty in establishing a patient diagnosis and treatment plan. ENM includes 4 types of MDM: straightforward, low complexity, moderate complexity and high complexity. What does POA mean? POA is a way for a hospital to determine which condition existed before the patient came to the hospital and which condition existed after admissions. For example, I have given an example here. You can read it carefully and understand like what is exactly POA means. And what is a POA indicator? It is a data element shown as a single letter that a medical coder assigns based on whether a diagnosis was present when the patient was admitted or not. POA indicator is required on all diagnosis code. So then PO indicator is required for what are the things that is given in the second paragraph. Please do read it. So wish you all the best for your interview. Go through all the questions and it will be really helpful for you. Thank you so much. Take care. Bye-bye.